Hi. Great. We are back at the 2:00 hour of House Healthcare, and we have our fabulous legislative council with us to go over a review of bills that we passed in the previous biennium. And so we had Ameren with us today for healthcare reform, which was fabulous. And Katie McGlynn is with us now. And we'll have her do a little introduction, but she's not been in here with the full committee yet. So why don't we go around? And Art, start with you, some introduction.
Yeah, Representative Art Peterson, Rutland District 2's area around south of Rutland.
Leslie Goldman, Bells Falls area, Winooski Street.
Daisy Rebecca Winooski. Mary Cordes from Lincoln.
Topper McFawn. I'm from Barrytown. And Williamstown.
Lori Houghton, City of Essex Junction.
Alyssa Black, Northern Essex.
Alan DeMar, Enosburg, Montgomery.
Joe Andriano, I represent the Addison Rutland District, which is in southwestern Addison and northwestern Rutland counties.
Bobby Farley's Rubio, I represent Caledonia 1, which is Barnet, Reigate, Waterford.
Great, thank you. I'm Katie McGlynn. I'm half of the Healthcare and Human Services team. You'll probably be seeing more of Ameren than you'll be seeing of me, but I'll pop into this committee on occasion. I handle issues related to public health and mental health in this committee. And then I spend a lot of time down the hall in Human Services. I deal with issues related to persons with disabilities, public assistance programs, substance use disorder, childcare, families, and children type issues. So if you have any questions on those topics, send them my way. And new members, and it's so nice to see all our returning members.
All right, so this is posted, correct? So we can find it on our website. You're going to put it up as well.
I'm going to try to do better than this morning.
Oh, you were great.
Technology. Okay, all right. Now, we are going to cover all of those bills that were passed by this committee, the House Committee on Healthcare, during the 2021 to 2022 biennium. So there are a couple of slides here where I've combined two bills that were on the same topic. Maybe there was a precursor bill in 2021, followed up by something more substantive in 2022, or the two bills were so closely related, it made most sense to cover them at the same time. So the first one I'm going to talk about is
Ameren, I'm sorry, I'm going to be rude and stop you right away. So when you go over the bills, you're going to tell us when there's something that is follow up this session as well, or we'll do that. I'll do that later.
There are going to be, you'll see that there's reference when there are reports due back to the committees of jurisdiction. So you'll see that noted in these slides, and then you'll hear it a second time when we go through our reports list. So you'll hear them now first, and then you'll get to hear about them again.
Great, thank you.
So first, these are two acts extending healthcare regulation flexibility during and after the COVID-19 pandemic. And then also one of the bills has coverage of healthcare services delivered by audio-only telephone. So the first act was in 2021. This was Act 6. It extends through March 31st, 2022, certain COVID-19 related healthcare regulatory flexibility provisions originally enacted in 2020 Acts and Resolves Act 91 and previously extended by 2020 Acts and Resolves number 140. For context, there were a number of provisions that needed to be put in place as a temporary measure when COVID-19 first started happening. And then as it became clear that the flexibilities needed to continue for longer than initially expected, these dates were pushed out in a number of acts. So this is the act in 2021. So you'll see it also extends for an additional year through June 30th, 2022, provisions allowing for variations from the usual statutory witnessing requirements for advanced directives executed during the COVID-19 pandemic. And then the act requires health insurance plans and Medicaid to cover all medically necessary, clinically appropriate healthcare services delivered by audio-only telephone to the same extent they would cover the services if delivered in person. So that occurred during 2021. Then you'll see Act 85 in 2022 extended a lot of those same pandemic-related flexibilities in those first two bullet points and continued those until March 1st, 2023. So just so that it's on your radar, there are some flexibilities that are due to expire March 1st of this year. Act 85 also creates a registration process to allow out-of-state licensed healthcare professionals to deliver healthcare services to patients in Vermont using telehealth during the period from April 1st, 2022 through June 30th, 2023.
If we can just stop right there real quick, just so it is on our radar that there are some flexibilities that expire. When the pandemic, well, it wasn't a pandemic, when COVID first came here, and a couple days before we thought we were leaving the State House for 2 weeks, of which was much longer, there were many stakeholders within the healthcare field that came together to help our committee and Human Services craft emergency legislation where this all started. And that coalition of healthcare providers has maintained contact and they work together. I just met with one this morning and they are meeting today to discuss what they feel we still need to have as waivers or flexibilities, whether something they want to move to permanent or something we just want to extend. So we will be looking at that. So, it might benefit you if you want to take some time one evening when you have nothing to do and just read through Act 6 or Act 85 or any of the information on the website. But you don't have to. We'll go into depth about what everything is that is needed to go forward and determine whether or not we should. Thank you.
Next, Act 21 and Act 107, which was in 2022. This is about facilitating the interstate practice of healthcare professionals using technology and OPR, which is the Office of Professional Regulation, authority to approve provisional licensing. So first in Act 21 of 2021, this act creates the facilitation of interstate practice using telehealth working group to compile and evaluate methods for facilitating the practice of healthcare professionals throughout the United States using telehealth modalities. And then there were findings and recommendations that were due on December 15th, 2021.
Representative Goldman.
I just wanted to mention that there's a report that would be very cool to send around because that was a really interesting process and how they came about it.
The working group report? Sure. I can make a note of that.
Yeah.
Good idea.
Then next in 2022, Act 107. This act creates a telehealth licensure and registration system that allows a healthcare professional who is not otherwise licensed, certified, or registered to practice in Vermont, but is licensed, certified, or registered in good standing in any other U.S. jurisdiction to obtain a telehealth license or registration from the Office of Professional Regulation or Board of Medical Practice to provide healthcare services to a patient in Vermont using telehealth. The act also allows the director of the Office of Professional Regulation to issue a 90-day provisional license in any field to an individual who has completed an application for full licensure and whose eligibility for licensure is contingent upon acceptable verification of licensure from another jurisdiction, whose eligibility for licensure is contingent upon completion of a background check, or who is an active duty member of the U.S. Armed Forces assigned to duty in Vermont or the member's spouse.
Now, was that, and I should know this, but is Act 107 a result of the findings of Act 21? Or is it a separate?
I think we did a telehealth bill, an audio only. We did the audio only telehealth.
Yes.
Yes, please.
Okay, this was interstate.
We're gonna
First one was interstate. This one, 107, was intrastate.
No, Jen Carvey, Legislative Council. So Act 21 in 2021, you directed this group to go off and figure out how to do interstate, facilitate the interstate practice of healthcare using telehealth. And then the Act 107 was kind of the result. So they came back with these recommendations.
Okay, it was.
You looked
Okay.
at you enacted the recommendations, creating that provisional and the telehealth license and telehealth registration as a result.
So Act 107 was as a result of
Yes.
the findings. Thank you.
Thank you.
Okay, next. I should say before we jump in that we've organized, for the most part, this presentation by numerical act order. So all of the, except for the two previous slides. So moving forward, you'll sort of address the acts that passed the first year of biennium first, and then we move to the acts that were passed in the second year of biennium.
And I'm sorry to interrupt, but maybe you can explain how, very briefly, difference between an H, an S,
Sure.
an act.
Yes. So if we're designating something as H period and then a number, or S period and then a number, that means it's a bill that's moving through the process. Once it has an act number, that means it has been enacted and it's law. In terms of Y and H or Y and S, the H stands for House, S stands for Senate, and that just indicates where the bill started. So in this case, this was H46, so it is a House bill. It started in the House. It moved out of a House committee first. After it passed the House, it went to the Senate, and then it finally was enacted.
And correct me if I'm wrong, but there could be instances where an Act 30 of 2022, there could also be an Act 30 of 1999.
Yes.
We repeat the numbers every year.
Every 2 years.
And some by every 2 years, every biennium. Okay.
Yep.
So sometimes if you put something in, you're trying to do some research and you're like, well, that isn't anything I'm connected with. You're going to need to put a year in, right?
Like Act 48.
Yes, good example. Yeah,
And lots of Act 48 since 2011.
right.
They're not well known.
And it becomes an act when the governor signs it.
Or if it becomes law without the governor's signature.
Or you override his.
Yeah.
Oh, yeah.
Third scenario.
Thank you.
So this act, an act relating to miscellaneous provisions of mental health. So first, it specified that the consent form required prior to an individual's voluntary admission on an inpatient psychiatric unit include representation that the individual understands that the treatment may occur on a locked unit, and a requested discharge may be deferred if the treating physician determines the individual meets the statutory criteria for involuntary treatment. So basically what this is saying is that there's already a consent form that somebody is signing when they're receiving voluntary treatment on an inpatient unit. And this is saying that they're also being provided notice and signing that they understand that the treatment is on a locked unit, and that at some point they may the individual may decide they are ready to leave, which would be appropriate for somebody who's there voluntarily, but that depending on the person's healthcare provider, that physician might feel that the person has reached a different threshold of needing a care and maybe needs to be kept there involuntarily. So this provides that information to the person who's entering the unit voluntarily. The second aspect of this act was that it specifies that the existing requirement that a head of a hospital post excerpts of relevant statutes for psychiatric patients includes statutes pertaining to the process for changing the patient's status from involuntary to voluntary. So there was an existing requirement that certain information is posted, and this was an addition to information that had to be posted for patients to be able to have that information available to them.
Katie, can you define posted?
I would have to take a look at
Okay,
it. I believe the conversation we had at the time was about like literally being posted on a wall or being somewhere visible within the unit, yeah.
Okay.
But I
That's fine.
specifically need to take a look back.
No worries.
And then lastly, this required the Department of Mental Health to oversee, collect information, and report on data regarding the use of emergency and voluntary procedures. I'll just pause there to say, when we think of the term emergency and voluntary procedures, we think of seclusion or restraint, either physical restraint or chemical restraint, meaning emergency and voluntary medication, for patients admitted to a psychiatric unit, regardless of whether the patient is under the care and custody of the commissioner. And it extends a previous existing reporting requirement that was established in 2018 pertaining to patients seeking mental health treatment in hospital settings. And so that report is coming in January 15, 23, and then it expires.
Meaning that we won't get a report again.
Unless you extend it, correct? Okay, next. An action relating to addressing disparities and promoting equity in the healthcare system. For those folks who are in the room when this was passed, you'll remember that this was a heavy lift with a lot of testimony taken. So this established the Health Equity Advisory Commission to promote health equity and eradicate health disparities among Vermonters, including particularly those who are Black, Indigenous, or persons of color, individuals who are LGBTQ, and individuals with disabilities. And specifically, the commission is responsible for providing strategic guidance on the development of the Office of Health Equity, which was due to be established not later than January 1, 2023. We don't currently have an office. Providing advice and making recommendations to the Office of Health Equity once established. Reviewing, monitoring, and advising all state agencies regarding the impact of the current emerging state policies, procedures, practices, laws, and rules on members of the targeted populations. Identifying and examining the limitations and problems associated with existing laws, rules, programs, and services related to the health status of members of the targeted populations. Advising the Department of Health and the General Assembly on decisions related to health disparities and promoting health equity, including with regard to COVID-19 funds. To the extent funds are available, distributing grants to stimulate the development of community-based and neighborhood-based projects to improve health outcomes. And lastly, advising the General Assembly on efforts to improve cultural competency, cultural humility, and anti-racism in the healthcare system through training, continuing education requirements for healthcare providers and clinical professionals. And there's more. It required all state entities that are already collecting health-related individual data to disaggregate health equity data by race, ethnicity, gender identity, age, primary language, socioeconomic status, disability, and sexual orientation. And data related to race and ethnicity shall use separate collection categories and tabulations disaggregated beyond non-white and white based on recommendations from the Executive Director of Racial Equity and the Health Equity Advisory Commission. And then there were a series of reports due. I think most of them came in. One was related to the recommendations for distribution of ARPA funds. That was part of the fiscal year 23 budget. Recommendations on appropriate and inclusive terms to replace non-white on disaggregated data categories and tabulations between non-white and white. And some of these recommendations were to be part of the annual report that were submitted by the commission. So they're not necessarily standalone reports that are coming in.
I'm sorry, so are these reports caught up? Is that what you're saying? I'm just wondering what to look for.
Yeah, I think that these have all come in at this point, and I'd have to double check to confirm. What you still have coming in is an annual report from the commission, from the Equity Commission. And last year, the report was supposed to tackle some of these specific topics. So for example, there were FY23 budget recommendations on the use of ARPA funds that was supposed to be addressed in their annual report. So you already received that. You'll continue to receive the annual report. And I believe I think all of these have been addressed so far. I think most of them came in 2022.
Any other questions? We will, this is on our topic list, our very long topic list, so we will adjust this.
Okay. And then we have an act relating to establishing the Emergency Service Provider Wellness Commission. So just to sort of give you a step back of what this group does, there is a conversation in the committee about how emergency service providers often experience a great deal of trauma themselves and being exposed and arriving at, different traumatic crises, and they're responsible for the people who when they're arriving in situations and they're not necessarily knowing what to expect when they arrive. So This commission was created for the purpose of addressing the mental health and wellness of emergency service providers. The group itself that was created was an incredibly long list. I don't know if members who are here remember, but it was a very broad list of emergency service providers who are represented on the commission. And then I've listed out all of the purposes of the commission. I know you have a lot to cover, so I'll just sort of hit the high points. There's an emphasis on identifying where there could be increased supports and strategic investments, identifying how Vermont can increase capacity for qualified clinicians, treating emergency service providers, a recognition that the families of emergency service providers also have a responsibility and have challenges related to the trauma, the secondhand trauma of the person and their family who has responded to an emergency, and then recommendations on policies, practices, training, legislation, rules, and services that increase successful interventions and support for emergency service providers.
I would just tell new members, let new members know that the testimony we heard here was heart-rendering. I mean, this was one of those things that hard to listen to. It was for me. I mean, it was incredible to listen to. Some of it hit close to home, and some one of the things happened in Rutland. It was just, it was tough.
It was.
Totally agree. But no report is what I'm saying.
They had an annual report that they will have, and I don't know if I've said this to the whole committee yet, but Amron and I have put together a chart that is going to hyperlink all the reports. That's organized chronologically about the date coming in. I think we're going over that with this committee next week.
I think so.
So you'll have that, and this is one of the annual reports that comes in every year.
Thank you.
So this was it for the bills that I worked for this committee in the last biennium. So I'm going to turn it over to Amron to finish the presentation. But I appreciate meeting everybody, and I'm looking forward to working with all of you this biennium.
Great. Thank you, Katie.
Okay.
I'm realizing I don't think I formally introduced myself for the record when I started speaking earlier. So Cameron Abergailey, Office of Legislative Counsel.
Amron, we're all learning together. Joint process.
Okay. So next is Act 48, an act relating to eligibility for Dr. Dinosaur-like coverage for all income-eligible children and pregnant individuals, regardless of immigration status. This act requires the Agency of Human Services to provide coverage equivalent to the coverage under Dr. Dinosaur program to children, and in this case, children are defined as those under the age of 19, and to pregnant individuals who are not eligible for Dr. Dinosaur because of their immigration status. The coverage becomes available beginning on July 1st, 2022, subject to fiscal year 2023 appropriations.
Any questions?
Next, you have Act 61, an act relating to healthcare practitioners administering stem cell products not approved by the U.S. Food and Drug Administration. This act requires a healthcare practitioner who administers one or more stem cell or stem cell related products not approved by the U.S. Food and Drug Administration to provide each patient with a written notice before administering a product to the patient for the first time. The act also specifies that a healthcare practitioner's failure to comply with its notice, advertising, and disclosure requirements constitutes unprofessional conduct under the Board of Medical Practice and the Office of Professional Regulation Statutes. And the reason it's both those entities is that there are some healthcare professions that fall under the jurisdiction of the Board of Medical Practice, and then there are others that fall under the Office of Professional Regulations jurisdiction.
Go ahead.
Can I ask what prompted the need for this?
So there was at the time, if I remember correctly, advertisements happening on newspapers and on the radio for businesses that were administering this type of, I don't know which treatment. And the chair at the time was very interested in it, and we became very interested in, having a way that can hopefully protect Vermonters by at least giving them notice of what they're, being told is and not told. Snake oil.
Yeah, I was just thinking that in my head.
What'd you say? Snake oil.
Snake oil, yeah. Snake oil warning bill.
And UVM was concerned, because they do these in the sort of legitimate settings, because the FDA said this is legitimate, this is not legitimate, and UVM wanted to be sure that they were following the law.
Okay.
Representative Golden reported the bill and she
My
did an
first
excellent
report-
job.
Did we not have an advocate for this testify to us too? I think this was one where a gentleman came in and
He wrote a letter.
he wrote a letter. He never came in.
Right, he
Okay.
wrote a letter,
We did have that,
right.
so, yeah.
Okay. To know, thank you.
And I will just say that OPR, the Office of Professional Regulator, they were so supportive. She's now moved on into a higher, she got promoted, but there's a lot of people that support us in these reports, so they're the people to know.
Yeah.
Good.
Next is Act 99, an act relating to enrollment in Medicare supplemental insurance policies. This act requires the Department of Financial Regulation to collaborate with health insurers, advocates for older Vermonters and other Medicare eligible adults, and the Office of the Healthcare Advocate to educate the public about the benefits and limitations of Medicare supplemental insurance policies and Medicare Advantage plans. It also directs the department to convene a group of interested stakeholders to consider issues relating to Medicare Advantage plans and Medicare supplemental coverage, and to report to the legislative committees of jurisdiction on or before January 15th, 2023. This is another report that you will be seeing in the next week or so.
And there, if you've noticed, there's a theme, reports tend to come back on January 15th. I don't know why we always pick the same day for everything, but we do.
We can switch it up this week.
Right,
14th.
14th, right.
Reports.
Every day a report.
Right.
Next is Act 108, an act relating to health insurance coverage for hearing aids. This act requires large group health insurance plans to cover hearing aids and related services beginning in the plan year 2024. It also codifies the requirement that Vermont Medicaid cover hearing aids and related services, and requires the Departments of Vermont Health Access and of Financial Regulation to report on or before November 1st, 2022 on the status of the state's application to the federal government to modify the essential health benefits in Vermont's benchmark plan to include coverage of hearing aids and related services in individual and small group health insurance plans beginning in plan year 2024.
So you may not know this off the top of your head, but one of the questions I have is how the recent federal change for hearing aids does or does not affect this legislation that we passed.
You mean the authorization to sell over-the-counter hearing aids?
Right. So I don't know if it does have anything, and it's, just something to notate and maybe let us know.
In terms of whether the insurance coverage would cover over-the-counter hearing aids?
Right. I mean, I would think we would still need this and make sure, it moves forward. I don't think it's a duplication, but.
Well, the coverage requirement for this requires it be prescribed. I'm certain, in which case over-the-counter, unless you have a prescription for over-the-counter.
Right.
Otherwise it would not cover, because a prescription is required for coverage.
Okay.
Under this bill.
Under this plan. Okay. Because there's still some, there are hearing aids that are offered over the counter, but there are still hearing aids that are only offered through a prescription.
Yes.
Would be okay. Great, thank you.
So we should have heard something by November 1st on where that status is.
There was a report due in November. I have not checked to see whether it came in.
Yeah, so we're gonna do a little like kind of quick reports thing, because that I've never really got my head around.
But so what we're gonna do is we'll do the reports time when Ameren and Katie come back in, and then after that, we can spend some time looking at how to find things.
Okay.
Thanks, Ameren.
Next is Act 119, an act relating to patient financial assistance policies and medical debt protection. This act establishes minimum standards for financial assistance policies at Vermont hospitals, hospital-affiliated outpatient clinics and facilities, and ambulatory surgical centers, which these facilities must meet not later than July 1st, 2024. It sets forth processes for the facility's implementation of their financial assistance policies, specifies the steps the facilities must take to publicize and notify patients about their policies, and prohibits the facilities from selling their medical debt. The Act also requires hospitals to submit a plain language summary of their financial assistance policies to the Green Mountain Care Board as part of the hospital fiscal year 2025 hospital budget review process.
And this is
Melissa
what,
was fabulous, yeah.
this is what Representative Black was talking about with Mike Fisher from the Healthcare Advocate Office.
A great report too.
Next is Act 130, an act relating to miscellaneous changes affecting the duties of the Department of Vermont Health Access. This act eliminates a 2-visit per year limitation on Medicaid coverage of preventive dental services for adults. It also updates and consolidates provisions relating to the pharmacy best practices and cost control program in the Department of Vermont Health Access.
I guess Woody did that one. I'm trying to think back.
Good memory.
Yeah. We should celebrate all these reports they were.
I totally forgot about that one.
Yeah.
Next is Act 131, an act relating to pharmacy benefit management. And I'll just mention that I'm covering this slide right now, but pharmacy benefit managers is going to be a topic that Jen is handling moving forward. So for ease, I'm going to cover it today, but if you have more questions about this, those should go to Jen. And if you forget, that's fine. I will send them to her.
We have a lot of questions about this one.
I can't believe of all things she's keeping this one.
I know.
The stuff for the new folks, again, this was something that,
Oh, this was insane.
I mean, trying to understand what this is.
It's coming back too. We're doing it again.
Only Mari knew.
She did such a great job. Getting everybody
Oh,
together.
boy.
It was huge.
It's
And then at
very
the end, there was all
complicated.
this dynamics and it was really exciting.
Oh,
Exciting.
All right, let's hear about it.
This act directs the Department of Financial Regulation to monitor the cost impacts and pharmacy benefit manager regulation and recommend changes as needed to promote health affordability. The act expands certain prohibitions and requirements for PBMs and provides additional rights to pharmacies during a PBM audit. The act requires the Department of Financial Regulation, in consultation with interested stakeholders, to consider issues including PBM licensure, spread pricing, pharmacist dispensing fees, and with the Board of Pharmacy, issues regarding pharmacist scope of practice. Department of Financial Regulation's findings and recommendations are due to the legislative committees of jurisdiction on or before January 15th, 2023. So Act 137, relating to miscellaneous provisions affecting health insurance regulation. So this act requires health insurers and healthcare providers to comply with the requirements of the Federal No Surprises Act. The act updates and further delineates the requirements for an association or trust to be eligible to purchase a group health insurance policy for its members. The act modifies and clarifies the Department of Financial Regulation's reporting and rulemaking authority. It creates the Insurance Parity in Residential Care for Children and Youth Working Group to increase access to appropriate mental health treatment for children and youth who are enrolled in commercial health insurance. And lastly, the act separates the individual and small group health insurance markets for plan year 2023 and requires the Department of Financial Regulation to convene a working group to look into maintaining separate markets in future plan years. Once again, reporting back January 15th, 2023.
Yes, and so on that last one, there's going to be a whole lot more we have to do on that because that all goes back to the subsidies that are available on the Vermont Health Connect. And the federal government passed the Inflation Reduction Act, was it in that one? That extends those subsidies for 3 years. And so we will have to address the individual and small group markets and how they have always, well, not always, they were put together in order for, risk purposes. And then because of the subsidies, we broke them apart. So we would have to extend them to stay apart for the time that the federal government is providing the subsidies. And then at some point, we'll have to look at what we want to do once the subsidies go away. So that is something we'll be coming back to.
And lastly, Act 167, this is a large one, it's a 2-slide act. An act relating to healthcare reform initiatives, data collection, and access to home and community-based services. So this act requires the Agency of Human Services, in collaboration with the Green Mountain Care Board, to develop a proposal for a subsequent all-payer model agreement with the federal government to secure Medicare's continued participation in multi-payer alternative payment models in Vermont. It also directs the Green Mountain Care Board, in collaboration with the Agency of Human Services, to develop value-based payments for hospitals that will reduce inefficiencies, lower costs, improve population health outcomes, reduce health inequities, and increase access to essential services. The Health Information Exchange Steering Committee is also directed to include a data integration strategy in its 2023 HIE strategic plan and to continue its efforts to create a single integrated health record for each individual. It directs the Department of Financial Regulation to explore the feasibility of requiring health insurers to access clinical data from the HIE to support prior authorization requests. It specifies that Vermont's blueprint for health initiatives must include quality improvement facilitation and other means to support quality improvement initiatives. Want me to pause before I go to the next slide?
Yes. 1 second, Representative Tina. So this is a piece of legislation we will come back to throughout the course of the biennium, either as one whole unit or in the various entities that have a piece of it that will be coming in to explain what they're doing. So if you're interested, I highly recommend just reading the legislation as a homework assignment at some point. We're not taking it up anytime soon. But it is, this was an integral piece of what we did. I will say those pieces of legislation that in the beginning no one really liked, which to me means we're probably doing something okay with it, and that it has set forth a lot of work that occurred over the summer with the Agency of Human Services. And when the secretary was in today and talked about looking at the stabilization and sustainability of our healthcare system, that's part of what this legislation is asking them to do. So again, if you're interested, I'd read it. We can talk offline at any point, and it will be something we come back to. Representative Sheena?
I'm sure I can look myself, but you might know quicker. When are we supposed to hear the 2023 Health Information and Exchange Strategic Plan? Like, when do we get about that strategy?
What day is today? What day is today, the 11th?
January 15th. I
What day?
don't know if there is a date.
Statutory, so is that
Okay.
Yeah, that's why I asked, because I could look, but lawyers are better at this and, they're quicker.
And while Lori nailed this, and it was huge amount of work between the Senate and the House, so thank you. It was really big.
I don't recall offhand.
So DEVA is supposed to submit its proposed health information exchange plan or technology plan annually to the Green Mountain Care Board by November 1st, and then the board has 45 days to approve, reject, or request modifications. If they haven't done any of those, then it's deemed approved. So I don't know that it necessarily, I don't believe there's a specific requirement to submit it to the General Assembly, but it exists and we can certainly ask for it.
Thank you, that's really helpful to know.
And that is jogging my memory that this was actually discussed at the Green Mountain Care Board this November, December timeframe as well. So when we have them come in, we can ask for more.
Thank you.
We good?
It's nice that something wasn't January 15th.
Right. All right, Aaron.
Second slide.
Oh, I'm sorry. I thought we were done. That works out.
I mean, I'll leave.
Maybe, no. Maybe people will, we can pick it.
Act 167, Part 2. The act requires the Agency of Human Services to recommend the amounts by which health insurers and Vermont Medicaid should increase their monthly per person per month payments toward the shared costs of Blueprint's community health teams and quality improvement facilitation, and provide an estimate of the necessary state funding for Medicaid's share of the increase. This is a report back January 15th. The act directs the Department of Disabilities, Aging, and Independent Living to convene a working group to make recommendations on extending access to long-term home and community-based services to a broader cohort of Vermonters and family caregivers, and recommendations on changes to service delivery for individuals who are dually eligible for Medicaid and Medicare. Report back due January 15th, 2024. So that's a further date out. The act expresses legislative intent to reimburse Medicaid participating providers at 100% of Medicare rates with first priority for primary care providers, and directs the Department of Vermont Health Access either to include this level of reimbursement for primary care services in its fiscal year 2024 budget proposal, or to provide information on the additional sums necessary to achieve reimbursement parity with Medicare's primary care rates.
So pause for a second. So on the first one, we will have blueprint in, I think, Friday. And they will be asking for an extension on that report. So don't look for that one on January 15th. And then the second one is language that services, I believe, worked on. So, collaboration there. And then obviously the third one's very important because Medicaid rates for providers is a key focus of this committee. Any questions? Is that all of them?
That's all of them.
Wow. So pretty exciting what we did. It's a, look at what this committee can do going forward. We do, the DEVA bill, and there was another bill that we kind of refer to as technical changes. So agencies might come to us and say, we're doing things one way and it says this in statute, so it's more of a technical cleanup. And then obviously there's large pieces of legislation that we pass. Representative Peterson?
Well, I was just going to say, Lori, that the other things we do, though, that aren't shown here is the budgetary stuff.
Yes.
It's interesting to note how much of our time was really spent putting the budget together.
Yes. That's a really good point.
A whole bunch of time.
Right, which next week, not next week, but the week after, it will be a bunch of time on budget adjustment. And then the 20th, the budget address from the governor will be given to the assembly and goes to appropriations first. They get testimony, and then we will start that budget process. So that is a big chunk of the first part of our time here. Once it's passed out of the House, it goes to the Senate, but it always starts in the House. Any other questions or about anything that happened today? Great, thank you, Amren. You're welcome, Jen. So we are done for the today. We are back. I'm gonna look at my schedule this time. We are back tomorrow morning, and we have the Department of Health, and then we have the Department of Vermont Health Access. So that will be great. And then in the afternoon, we have Nolan reviewing the global commitment, which is our Medicaid waiver. So tomorrow will be a really good introduction to the agencies that we work most closely with. So great. Thanks, everyone.